welcome to our Monday Minute. Today we're going to discuss the signature of the Continuing Appropriation and Extensions Act of 2026 that occurred last week and how that directly impacts home health and hospices. The first, most important to most agencies, is the reality that the telehealth face-to-face encounters has been extended through January 30th of 2026. So there was what we thought to be a lapse between October 1st and the date that this legislation was passed. But in the legislation, it made it very clear that they simply removed the deadline of September 30th and extended that to January 30th of 2026. That being the case, if you were to have accepted any face-to-face encounter that was completed via telehealth from October 1st through the time that this bill was signed, it will be valid. And so even today, in mid to late November, as you are admitting new patients, if the face-to-face encounter that you are accepting for that patient in home health is within the previous 90 days, you are allowed to use it if it meets all the requirements. If that was done via telehealth in the month of October, you will be able to accept that face-to-face encounter. Hospice is a little trickier because the face-to-face encounters can be done up to 30 days prior if the patient is being recertified, so could still fall into the window of October if those were done via telehealth. They will be acceptable. Please note and continue to validate in the documentation that if you are accepting a telehealth face-to-face encounter, whether home health or hospice, it must document from the practitioner that conducted the encounter that it was done via both audio and video. So it was not audio only. In addition to that, you need to confirm that the platform that is being used for the telehealth encounter is considered HIPAA compliant. The other elements that I want to touch on from the reopening of the government, one, TRICARE payments were seized or ceased to be paid out during the month of October. Those have been reinitiated and, of course, will be retroactively paid for any services in the time period that the government was shut down. And lastly, the PAYGO element that was introduced in 2010 that would have added an additional 4% to sequestration has been waived as a part of this legislation. So that additional 4% will not be added to sequestration, at least at this time. Thank you all for participating today. We in home health are actively continuing to wait very anxiously for the final rule to be released for 2026 implementation. And we will get you an update on that as soon as we possibly can following its release. Have a fabulous week, and we will talk to you again soon.